Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Knee replacement, physical therapy. Introduction. Knee replacement surgery is a very successful and safe operation, but long-term success mostly depends on the patient. The muscles around the knee joint must be strengthened after surgery, and the patient needs to recognize the limitations of a new knee. This program reviews necessary steps that must be taken in order to get the most out of a new knee. Anatomy. The knee joint connects the femur or thigh bone to the tibia or the shin bone. The knee moves in one plane only, up and down, not side to side. Ligaments protect the knee from going sideways and getting injured. Even though the joint allows movement, the muscles of the legs perform the actual motion. The two main muscle groups involved in the motion of the knee joint are the quadriceps muscles, also called quads, and the hamstring muscles. Most of the quads are located in the front of the thigh. They anchor at the front of the shin bone or tibia. These muscles allow the knee to be straightened out. Most of the hamstrings are located in the back of the thigh and allow the knee to bend back. The quads and the hamstrings are essential for almost every daily physical activity we do, such as walking, running, going up and down stairs, squatting. Artificial knee. Artificial knees have improved a lot over the years. They are made of three parts. The first is anchored in the femur and the second is anchored in the tibia. The third is anchored under the kneecap. You may have 2 or 3 of these components depending on what you and your healthcare provider have decided. Knees work the same way as a hinge joint. Artificial knees allow a very wide range of motion, though slightly less than a normal knee. Artificial knees depend on the muscles of the legs in order to stay in place. This is why it is very important to strengthen the muscles in the knee area after a knee replacement. It is best to strengthen all of the muscles of the legs. Leg muscles are usually weak if they have not been used for months or years due to pain. The risk of dislocating a new knee joint is the highest during the first 6 to 8 weeks after surgery. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Physical therapy. With time and physical therapy, your new knee will work and feel like a normal knee, but there might be pain and stiffness in the knee at first. Your orthopedic surgeon may recommend using a knee immobilizer, crutches, or a walker right after the surgery to ease the pain. Your healthcare provider may bend your knee to loosen up your new joint. Do not put a pillow underneath the operated knee to prevent muscle tightness of the knee extensors. The healthcare provider will also let you know how much weight you can put on the operated leg. As your physical therapy progresses, you will be able to put more and more weight on the leg. It is your responsibility to go to physical therapy, strengthen your leg, and improve the range of motion in your new knee. The healthcare provider will guide and help you after your surgery. Right after surgery, when the knee is still healing, it is important to ask for enough pain medication to overcome surgical pain and start the exercise program. After a while, pain usually disappears completely and exercising becomes more enjoyable. This may take up to a year. As with any physical therapy program, there are a few main guidelines to remember. The following pages show some tips to help you as you strengthen your new knee joint. Start slow and progress gradually. Set achievable goals for yourself and discuss them with your physical therapist. Examples of such goals include walking 100 yards, going up or down the stairs, straightening the knee fully, helping around the house, taking short walks around the house or the block. Reward yourself as you achieve goals. If you reach a long-term goal, you could buy yourself a new outfit or rent a good movie. Ask family and friends for help and motivation. For example, someone could walk with you and keep you company. Stay in shape. Keep doing the exercises even years after your operation. Some pain may be expected. Lots of pain is not. Call your healthcare provider for advice or help at any time. Exercises. Quadriceps setting. While lying on your back, keep your legs straight, together, and flat down with your arms by your sides. Tighten the quads one leg at a time while pushing the back of your knee down. Hold for 5 seconds, then relax for 5 seconds. Repeat about 10 times for each leg. You can do several sets of this exercise a few times every hour if you can manage any pain you have. Passive knee extension. Place the heel of the foot on a pillow or towel roll. Relax the leg and let gravity assist in straightening the knee. Hold for 10 seconds. Repeat 3 times per day. Terminal knee extension. While lying down, place a pillow under your knees so that they are bent at a 30 or 40 degree angle. Straighten one leg at a time. Hold it straight for about 5 seconds, then relax it slowly back to the initial position. Repeat 10 to 20 times, as much as you can manage the pain. Straight leg raising. While lying on a bed, bend one leg, pulling the foot toward your body until the foot is flat on the bed. Raise the other leg while keeping it straight with the heel about 6 to 10 inches above the bed. Hold for 1 to 2 seconds, then relax slowly. Repeat 10 to 20 times. Knee flexion. Right after surgery, your knee may feel stiff, especially when you bend it. You should eventually be able to bend your knee 90 degrees. Sit in a chair and tighten the back of the thigh while bringing the heel toward the chair. Hold for 5 seconds and then relax. Repeat 10 to 20 times for each leg. Ankle. 2 exercises. 1. Slowly move each foot separately in a circular motion, first clockwise, then counterclockwise. Repeat 15 to 20 times. 2. While lying down, place a towel under the calf so that the heel is raised up. First point the foot toward the nose and hold it for 5 to 10 seconds. Then point it down and hold again for 5 to 10 seconds. Repeat 15 to 20 times. Hip extension. Gluteal set. Lie down flat and squeeze your buttock muscles together without holding your breath. Hold together for 5 to 10 seconds. Repeat 15 to 20 times. Knee and hip flexion. While lying down flat, slide one heel at a time towards your body to a bent knee position. Hold for 5 seconds. Repeat 10 to 20 times. Knee and hip flexion with assistance. Do a knee and hip flexion exercise while pulling the foot toward the buttock using a rolled sheet. Hold for 5 seconds. Repeat 10 to 20 times. Hip extension. Bridging. While lying down with knees bent and feet flat, lift up the buttock and hold it for 5 seconds. Repeat 10 to 20 times. Heat and ice. Heat and ice can be used to aid with the exercises. Ice helps to decrease swelling and pain. A bag of crushed ice may be used for 10 to 20 minutes. A heating pad may also be used to loosen up the muscles and increase the knee's range of motion. It can also be used for 10 to 20 minutes. It is important to remember that your knee surgery may cause decreased sensation in the knee. Check the temperature of anything you put on your knee with your hand first. You should also look at the knee often while using heat to make sure you are not burning the skin. Other activities. Walking is recommended but does not replace the exercises pointed out in this program or by your healthcare provider. You should not drive until you check with your healthcare provider to make sure it would be safe. You should also refrain from sexual intercourse until you check with your healthcare provider. Patients who plan to undergo dental or surgical procedures should make sure to tell the healthcare provider about their knee replacement operation. They may need to be given some antibiotics to prevent the artificial knee from getting infected.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Artificial knees are made of 3 parts. The first is anchored in the femur, and the second is anchored in the tibia. The third is anchored under the kneecap. You may have 2 or 3 of these components, depending on what you and your healthcare provider have decided. With time and physical therapy, your new knee will work and feel like a normal knee, but there might be pain and stiffness in the knee at first. Knee replacement surgery is a very successful and safe operation. The long-term results of this operation mostly depend on your faithful efforts towards strength and endurance. It is important to exercise the leg and the whole body regularly. It is just as important to stay fit and not become overweight. The greatest majority of patients who have a knee replacement surgery are able to resume most of their activities and live active and painless lives. Thank you for using Explain.